Intestinal obstruction is an gastrointestinal disease. Look at this picture, shows that obstruction in large intestine. Look at this. Then X-ray findings and ultrasound. MRI findings and CT scan. Look at this. Detail going on. Introduction. Intestinal obstruction is a serious medical condition that occurs when the normal flow of intestinal contents is hindered or completely blocked. This condition can lead to severe complications if not diagnosed and treated promptly. It can be caused by a variety of factors, including mechanical blockages or functional impairments. A definition. Intestinal obstruction is defined as a partial or complete blockage of the bowel that prevents the movement of diagnosed food, fluids, and gas through the intestines. This blockage can occur in the small intestine or in the large intestine and can lead to severe complications if left untreated. Etymology. The term intestinal obstruction comes from the Latin intestinum, meaning gut or bowel, and obstructor, meaning to block or to obstruct. It refers to condition where the normal flow of intestinal contents is hindered due to blockage or impaired movement. Types. 1. Mechanical obstruction caused by physical blockages such as tumors, adhesions, hernias, valvulars, twisting of this intestine, or telescoping of a segment of the intestine into another. 2. Functional paralytic ileus occur due to the lack of normal intestinal motility, commonly seen after surgery, infections, or nerve damage. Causes. Mechanical causes: adhesions, hernias, tumors, valvulars, intussusception, impacted faces, gallstones, foreign bodies. Functional causes: postoperative complications, medications, example opioids, anticholinergics, electrolyte imbalances, infections, neurological disorders. Risk factors: 1. Abdominal or pelvic surgery. 2. Hernias. 3. Inflammatory bowel disease. 4. Tumors. 5. Strictures. Narrowing of the intestines. 6. Chronic constipation. 7. Use of narcotic medications. Complications: 1. Intestinal perforation. 2. Sepsis. 3. Dehydration. 4. Electrolyte imbalances. 5. Bowel necrosis. 6. Peritonitis. Pathophysiology: intestinal obstruction disrupts the normal flow of digestive contents, leading to fluid and gas accumulation proximal to the blockage, causing distension and increased intraluminal pressure. This can compromise blood flow, resulting in ischemia, bacterial overgrowth, and potential perforation if untreated. Pathophysiology of intestinal obstruction, step by step process. 1. Obstruction initiation. A physical or functional blockage occurs in the intestine. Common causes including adhesions, tumors, hernias, volvulars, or impacted spaces. 2. Accumulation of intestinal contents, fluid, gas, and ingested food built up proximal to the obstruction. Increased intraluminal pressure causes bowel distension. 3. Increased peristalsis, early compensation. The intestines attempt to push contents past the obstruction, leading to hyperactive bowel sounds. Patients experience cramping and corky pain. 4. Compromised bowel flow, persistent pressure, impaired venous return, leading to bowel wall edema. In severe cases, example valvular strangulated hernia cause arterial occlusion leading to ischemia and necrosis. 5. Bacterial overgrowth and translation. Stagnant intestinal contents promote bacterial proliferation. Bacteria may translocate across the damaged mucosa, increasing the risk of sepsis. 6. Fluid and electrolyte imbalance, vomiting and third spacing of fluid into the ball and peritoneal cavity lead to dehydration. Hypokalemia and electrolyte imbalances. Hypokalemia, metabolic alkalosis, 7. Systemic complications. Persistent obstruction and ischemia can result in bowel perforation, peritonitis, and septic shock. If untreated, multi-organ failure and death may occur. This sequence of events explains the progressive worsening of symptoms in the intestinal obstruction and underscores the need for timely intervention. Signs and symptoms. 1. Abdominal pain and cramping. 2. Vomiting may contain bile or fecal matter. 3. Distended abdomen. 4. Inability to pass stool or gas. 5. Bowel sounds. Hyperactive in early stages, absent in later stages. 6. Dehydration, dry mouth, reduced urine output, hypotension. A diagnosis. 1. Clinical examination, abdominal palpitation, auscultation for bowel sounds. 2. Imaging studies, X-ray, CT scan, ultrasound. 3. Laboratory tests, complete blood count, CBC, electrolytes, and blood gas analysis. Nursing diagnosis. 1. Acute pain related to bowel obstruction. 2. Risk for electrolyte imbalances related to fluid loss. 3. Risk for infection related to compromised bowel integrity. 4. Impaired gas exchange related to abdominal distension and pressure on the diaphragm. 5. Anxiety related to hospitalization and uncertain prognosis. Medical management. 1. Nasogastric NG tube insertion decompresses the stomach and relieves pressure. 2. Intravenous IV fluid to correct dehydration and electrolyte imbalances. 3. Pain management. Avoid opioids if possible, as they may worsen the obstruction. 4. Antibiotics. If infection is suspected. 5. Surgical intervention required for complete obstructions, necrosis, or perforation. Nursing management. 1. Monitor vital signs and fluid status. 2. Administer IV fluids and medications as prescribed. 3. Maintain strict intake and output records. 4. Monitor bowel sounds and abdominal distension. 5. Provide psychological support and education to the patient and family. 6. Prepare the patient for surgery if needed. Treatment options. 1. Conservative management includes fluid resuscitation, bowel rest, and decompression for partial obstructions. 2. Surgical treatments requires for complete obstructions, ischemia, or perforation. 3. Endoscopic procedures sometimes used to remove blockages such as polyps or strictures. Psychosocial medicine. 1. Emotional support addressing fear and anxiety related to hospitalization and surgery. 2. Patient education explaining the condition, treatment options, and prognosis. 3. Support groups encouraging participation in community or online support groups. 4. Counseling services referral to a psychologist if needed. 5. Family involvement educating caregivers on dietary modifications and warning signs of recurrence. Prevention. 1. Maintain a high fiber diet to prevent constipation. 2. Stay hydrated. 3. Engage in regular physical activity. 4. Avoid excessive use of laxatives or narcotic pain medications. 5. Seek medical attention for persistent abdominal pain or changes in bowel habits. In conclusion, intestinal obstruction is a potentially life threatening condition that requires prompt recognition and management. Understanding its causes, risk factors, and treatment options can aid in early diagnosis and prevent complications. Thank you. Have a nice day.